So femur is the long bone which has a head, a neck, greater trochanter, lesser trochanter, shaft, and the lower end. The shaft is divided into upper one third, middle one third, and lower one third. Upper, middle, and lower. On the upper end, the features are head, neck, greater trochanter, lesser trochanter. On the posterior surface, there is a line on the middle of the shaft called as linea aspera. Linea aspera. If you trace the linea aspera above and below, down it converges medially medial supracondylar line, inferior laterally as supracondylar line, and if you trace it above, again it converges as two lines above and below. What is present laterally is the gluteal tuberosity. What is present is the medially is the intertrochanteric line. Intertrochanteric line. This is how the architecture is present on the shaft. Okay. So this line we call it as linea aspera. Linea aspera. Linea aspera. These are all the bony landmarks you should remember. And this is the intertrochanteric fossa. And this is the greater trochanter. Greater trochanter. On the lower end, you have medial condyle and lateral condyle. The condyle is the epicondyle. Lower dorsal condyle. What is present above is the epicondyle. On the medial aspect of the shaft, there is one more tubercle called as adductor tubercle. Adductor tubercle. This is important, which gives attachment for adductor magnus muscle. Largest muscle of the medial compartment is the adductor muscle. Adductor magnus muscle. Adductor magnus muscle. Head, neck, greater trochanter, lesser trochanter, and on the posterior surface, intertrochanteric fossa. So this intertrochanteric line of the anterior surface is going posteriorly towards the shaft of the femur. Tibia and fibula. This is medial, this is lateral. Tibia is medial, fibula is lateral. On the anterior surface, tibial tuberosity. This prominent border of tibia is called as, what is that tibia called as? Shin. It is called as shin. The two bones are connected by a membrane called as interosseous membrane. Membrane forming superior tibiofibular joint and superior and inferior tibiofibular joint. And on the upper surface of the tibia, this is called intercondylar area, where you have medial condyle and lateral condyle. This is called intercondylar area. Between the two condyles, right? Medially it is medial condyle. This is lateral condyle. Between the two condyles is called as intercondylar area. Intercondylar area. This bonus fibula. Lower down, this is the medial malleolus. This is the malleolus. Fibula has a neck, head and neck. Neck is related to common peroneal nerve. Common peroneal nerve. It divides into superficial peroneal nerve and deep peroneal nerve. Deep peroneal nerve supplies the anterior compartment of the leg. The superficial peroneal nerve supplies the lateral compartment of leg. This is the nerve which is enlarged in Hansen's disease as of ulnar nerve. There are two peripheral nerves which are enlarged in leprosy. Right? One is the ulnar. Look for ulnar nerve thickening. You put your finger, roll it behind the medial epicondyle of ulnar arm. If you can feel the thickening, that the patient have the Mycobacterium leprae infection. Likewise, you have to roll out your finger over the neck of the fibula. Thus, the peripheral nerves are involved. Two nerves are involved. One is the common peroneal nerve, other one the ulnar nerve. The site of location of ulnar nerve is behind the medial epicondyle of humerus. The site of common peroneal nerve is behind the neck of fibula. Neck of fibula. And what is the one more clinical importance of fibula? For bone graft, normally the bone we use is fibula. Any other peculiar feature? Fibula. The secondary centers uses earlier. Normally primary should be the secondary, but it is not obeying the bone which doesn't obey the law of ossification. Law of ossification is fibula. Foot architecture. On the upper surface, first bone is talus. Right during first talus, right? Tibia articulated. The lower end of tibia is resting on the talus. Lower down to the talus, it is calcaneum. Bone is calcaneum. Talus. Lower down to the talus, it is calcaneum. Calcaneum. Now, three bones in order: medial cuneiform, intermediate cuneiform, lateral cuneiform. Between the fourth and fifth metatarsal 4 and 5, the bone is cuboid. Innervating between first, second, and third metatarsal, here it is navicular. So totally 7 number. Can you able to see this? Number one, medial cuneiform articulate the first metatarsal, intermediate articulate with second metatarsal, third articulate the third metatarsal in order. Fourth and fifth articulate with third articulate with cuboid. It articulate with cuboid. Again, balance 14 in number, 2 for the thumb, 3 for other bits. So totally 14 in number. Up to this you are clear, right? Next, anterior compartment of thigh. Anterior compartment of thigh, which is called extensor compartment. Before we go to the muscle, there is one triangular interval on the front of the thigh. Femoral triangle, popliteal fossa. Additionally, you have to read. Like cubital fossa and quadrangular space on the upper limb, here we have to see femoral triangle and popliteal fossa. So the ligament, it is a triangular interval on the upper one third of the thigh. Triangular interval on the upper one third of the thigh, which is bounded above by inguinal ligament, laterally by sartorius, medially by adductor longus. Medially by adductor longus. Adductor longus, sartorius, inguinal ligament. This is the triangular interval. Roof is formed by superficial fascia and deep fascia. Floor is formed by, this picture, floor is formed by adductor longus, pectineus, tendon of psoas major and iliacus. Totally 4 muscles form the third very clear. This is number 1, this is number 2, number 3, this is number 4. That forms the floor of femoral triangle. Number 1, so adductor longus forms both floor and the boundary. That you should remember. Adductor longus. And the content of the triangle are femoral vein, femoral artery, femoral nerve. Femoral artery and femoral vein are closed by femoral Sheath, femoral sheath. The sheath contains three compartments: medial, intermediate, lateral. Intermediate compartment contains femoral vein. Lateral compartment contains femoral artery. The medial compartment contains clockwork group of lymph node, which drains the glans penis in male and clitoris in female. This is on male, this is on female, which is present on the medial most compartment of the femoral sheath. Is it clear? This is important. Clockwise group of lymph nodes drain what are all the structures. Glans penis in male and clitoris in female. Femoral vein, femoral artery. With its superficial branch and deep branches. Femoral artery at this level gives off three superficial branches. Superficial, external, pudendal, superficial, circumflex iliac, and superficial epigastric artery. And deep branch gives off deep epigastric and deep pudendal. So two branches. These are the branches of, I'll show on the picture, time being remembered. Know the location of the triangle, boundary of the triangle, what is femoral sheath, what are all the components of the femoral sheath, three compartment, how the compartment. So femoral nerve is outside or inside? Outside. Outside the femoral sheath. As we already discussed, this femoral nerve arises from the lumbar plexus with the root value L2, L3 and L4. Obturator also have the same value, but this is the anterior division of lumbar plexus, whereas obturator nerve arises from the posterior division. Am I right? So this triangular interval is, see on the roof, you get an opening. This is called as, this opening is for saphenous opening. Saphenous opening for great saphenous vein, which opens into femoral vein. Great saphenous vein is a superficial vein of the, like cephalic vein is lateral. Am I right? For the upper limb, cephalic vein is lateral or medial? Lateral. Basilic vein is medial. Connecting cephalic and basilic vein, it is median capital. So corresponding to cephalic, here on the medial aspect, it is great saphenous vein that pierces the cribriform fascia of the superficial fascia that drains into femoral vein. Great saphenous vein is draining into the femoral vein. And on T-shaped manner, you get the arrangement of lymph nodes. For the nerve, it is dividing into two trunks. Am I right? A single lumen is dividing into an anterior trunk and posterior trunk. And one important branch given out by the femoral artery here, it is medial circumflex and medial and lateral circumflex femoral artery. Medial circumflex and lateral circumflex femoral artery. Can you able to see the content once again? Very clear. Clocked group of lymph node, vein, artery, nerve. Clear, right? This superficial branches are 3 in number, deep are 2 in number. Next interval is, we'll come to muscle later, okay? What is this interval? Popliteal fossa, medial, upper, lower. Upper, otherwise superior, lower, otherwise inferior. Supromedial, infromedial. Suprolateral, infrolateral. Am I right? Now you see on the picture, supromedially it is bounded by semi-membranosus and semi-tendinosus. Supralaterally it is bounded by biceps femoris. Inframedially by medial head of gastrocnemius. Infralaterally by the lateral head of gastrocnemius. So that is the boundary of popliteal fossa. Supromedial, supralateral, inframedial, infralateral. So as for the roof is concerned, any roof is covered by skin, superficial fascia and deep fascia. Here the fascia is the popliteal fascia. The arrangement of the structures on the popliteal fossa are sciatic nerve, which is dividing into common peroneal nerve and tibial nerve. Femoral vein artery is deep. Popliteal artery is very deep. It is related to the posterior surface of the femur. More or less, the artery will be on the posterior aspect. Since it is a bony connection within the femur, erosion of the artery can be possible. That's the reason why popliteal artery aneurysm is common. And that cyst we call it as Baker's cyst. That cyst is called as Baker's cyst. Since it is in contact with the bone, constantly we are walking, flexing, and extending your legs. Right? That's the reason why the cyst is very common. And the tunica elastic fibers are minimal on the histology of popliteal artery. So the content of the popliteal fossa are sciatic nerve and its sciatic nerve with terminations common peroneal nerve. Common peroneal will divide into superficial peroneal and deep peroneal. Tibial nerve will supply posterior compartment of leg. Superficial this supplies lateral compartment. This supplies anterior compartment. Right. So there are three compartments of the leg. Each compartment has one nerve. Deep peroneal nerve supplies anterior compartment. Superficial peroneal nerve supplies lateral compartment. Tibial nerve supplies posterior compartment. So again on the roof, there is one small saphenous vein that drains into popliteal vein. So great saphenous vein drains into where? Femoral vein on the femoral triangle. Whereas short saphenous vein drains into popliteal vein on the popliteal fossa, which is accompanied by a nerve called posterior cutaneous nerve of leg. Posterior cutaneous nerve of leg. Posterior cutaneous nerve of leg. So on the roof, you see small saphenous vein and posterior cutaneous nerve. And flow is formed by the bone. Am I right? On the bone, you can see popliteus muscle. There is one more ligament on the floor called as oblique popliteal ligament, which is nothing but the tendinous expansion given off by the tendon of semimembranous. This you have to remember. Oblique popliteal ligament is an extension of what? Semimembranosus muscle. Semimembranosus muscle. Semimembranosus muscle, which is a muscle of posterior compartment of the leg. That oblique popliteal ligament is pierced by three structures. You have to memorize: middle genicular artery and nerve, genicular branch of posterior division of obturator nerve. Genicular arteries are branches from popliteal artery. Popliteal artery gives off genicular branches, upper, middle, and lower. We know femoral artery is on the thigh. That femoral artery will continue as popliteal artery on the popliteal fossa. Then it divides into anterior tibial and posterior tibial. Anterior tibial will come to the anterior compartment of the leg. Posterior is posterior. From posterior, you get peroneal artery for the lateral compartment. Femoral artery comes as popliteal, subclavian, axillary, radius, ulnar. Right? Here it is external ear continues as femoral artery continues as Popliteal artery. Popliteal artery divides into anterior tibial and posterior tibial. Anterior tibial continues as dorsalis pedis artery. Dorsalis pedis artery. Posterior tibial artery gives one branch to the lateral compartment called as peroneal artery. Called as peroneal artery. Oblique popliteal ligament, this you should remember. It is pierced by three structures: middle genicular vessels, mini genicular artery, and the genicular branch of posterior division of the data nerve. What is this bone? Hip bone, which is an example of irregular. It doesn't have proper shape. Three bones unite to form ilium, ischium. This is acetabulum. This is called obturator foramen. Obturator foramen. This is ischial spine. This is greater sciatic notch. This is lesser sciatic notch. Iliac crest. Anterior superior iliac spine. Anterior inferior iliac spine. Posterior superior iliac spine. Posterior inferior iliac spine. This is the gluteal line. Anterior gluteal line and middle gluteal line. Thereby, the iliac, this gluteal surface, this is the gluteal surface. It's divided into how many areas? Number 1, 2, 3. By means of how many lines? Line number 1, line number 2. Right? Two lines divide the gluteal surface of ilium into 3 areas. Am I right? Can you able to appreciate? There are 2 lines. This is first line, this is second line. Right? Divided by number 1, 2, 3. That divides the gluteal surface of the ilium into 3 areas. This is largest of gluteus minus gluteus. This is the gluteal fold. Space between the gluteal region called as gluteal fold. Once you cut open the gluteus, medius and so muscles, piriformis muscle. Once you peel off all the structure, you can see 2 ligaments. One is sacrospinous ligament, other one is the sacrocutis ligament. 2 ligaments are present due to the gluteus maximus muscle. Okay, those are the structures that are present due to the gluteus maximus. So, what is the importance of gluteus maximus? Gluteus maximus is divided into 4 quadrants where you give intramuscular injection. It is on the upper lateral quadrant. This is the site of intramuscular injection. Right? Two ligaments are sacroiliac cutaneous innervation are inferior gluteal nerve, posterior cutaneous nerve of thigh. 2 nerves supplies the skin over the gluteal region. Inferior gluteal nerve and posterior femoral cutaneous nerve. Now you see the 3 muscle: gluteus maximus, minimus, medius. 3 muscle, they act as the extensor of the hip. Remember, the gluteus maximus is inserted into one important structure called iliotibial tract. Iliotibial tract, which is the fascial sling on the lateral aspect of the thigh. 2 muscles are inserted on the gluteus maximus. One is Gluteus maximus, other one is tensor fascia lata. Tensor fascia, this you should remember. Tensor fascia lata, which is a muscle from anterior compartment, and gluteus maximus are inserted into the iliotibial tract. As the name indicates, where the iliotibial tract will be attached. Iliotibial. Ilium is above, tibia is below. Iliotibial tract, which is a fascial sling on the lateral compartment of the thigh. And once you remove the maximus, you can see medius. Am I right? Once you remove medius, you can see the minimus. And the key muscle of the region is piriformis. What you want to expect a structure emerging from the lower border of the piriformis lower down is sciatic nerve. It emerges below the lower border of piriformis muscle. Piriformis muscle. Piriformis muscle. If there is paralysis, key muscle, all the changes in the blood vessels will arise either lower down or above or below. Each region has key muscle, like axillary artery is divided into three parts by pectoralis minor. Likewise, subclavian artery is divided into three parts, right? Vertebral artery has four parts. So each region has some peculiar muscle, right? Maxillary artery divided by lateral pterygoid into three parts. So one muscle will divide some structure. Hyoglossus will divide the lingual artery into three parts. So each region will have one key muscle. For the gluteal region, it is piriformis. What is this? What is it? Paralysis of gluteus. It is not maximus. Gluteus medius causes paralysis of one side, right? For walking, you need a normal gait to be maintained by gluteus maximus. What occurs in paralysis? If the, say for example, this is the right and this is the left. This right side is paralyzed. You get, it is compensated or non-compensated? Non-compensated. Thereby, the hip has been tilted down towards one side. And sign we call it as Tenderberg sign. This is the undercover we finished. I said key muscle is, this is piriformis, and this is sciatic nerve. This is sciatic nerve. Posterior cutaneous nerve of thigh, and this superior gluteal artery and superior gluteal nerve. So remember, structures above and structures below. Very important is sciatic nerve and posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. See the attachment of the piriformis. What is this bony landmark? Greater trochanter. So piriformis arises from the ventral surface of the sacrum, from the middle three piece of sacrum. From the inner surface of the sacrum. See on this, you cannot see the piriformis origin, right? It is somewhere inside the sacrum. From the ventral, this is the dorsal surface of the sacrum now. This is the dorsal surface. What is related to the pelvic cavity is the ventral surface. So piriformis arises from the ventral surface, which is inserted on greater trochanter of femur. Next is obturator internus. Obturator internus. As the name indicates, it arises from the rami of the ischium. Now you trace the location, and what you should remember is, this is intertrochanteric fossa. It comes out as tendon. It comes out of tendon, a muscular fiber from the pelvis, from the medial surface related to the ischiopubic rami, comes out as a tendinous insertion towards the femur on the intertrochanteric fossa. Now you see above and below. The nerve related to piriformis. See on the picture, how many nerves are related? 1, 2, 3, 4 nerves are related to the lower border of piriformis. One nerve is related to the upper border of piriformis. This is important. The nerve related to the inferior border are prudental nerve, which is entering the prudental canal. It is entering prudental canal. This canal is prudental canal. Number 2 is posterior femoral cutaneous nerve or the posterior cutaneous nerve of thigh. Third one is the thickest nerve in the body. It is sciatic nerve. Number 4, it is, this is the site of intramuscular injection. Next is anterior compartment of the thigh. Anterior compartment of thigh. Otherwise called as extensor compartment. First muscle is sartorius, which arises from the anterior superior inserted on the tibia. Quadriceps represents how many? 4. Rectus, femoris, vastus, lateralis, vastus intermedialis, vastus medialis. This rectal structure is the rectus femoris. This is vastus lateralis. This is vastus medialis. Once you take off the rectus femoris only, you can see the vastus intermedius. What I want you to remember is the direction of the vastus medialis is more or less oblique on the lower plane. That prevents the lateral, it pulls the patella towards the medial side since it is, see this vastus medialis, can you able to see? If you compare with the lateralis and medialis, which fibers are more or less oblique and which are horizontal? Vastus medialis is horizontal fibers that pulls the patella towards the medial aspect, thereby the lateral displacement of the patella is not possible. Now again you see, already I told you patella is developed in the tendon of quadriceps femoris. Am I right? You trace it towards the insertion. This is the tendon of quadriceps femoris, which is coming towards the patella. So these are the muscles of the anterior compartment of the thigh, supplied by femoral nerve. Femoral nerve divides into an anterior division and posterior division. Anterior division supplies sartorius, and all other muscles are supplied by the posterior division. Quadriceps is innervated by the posterior division, whereas the anterior division is supplied by the rectus femoris. Rectus femoris. These are the muscles which are inserted into the patella. On the upper border, vastus intermedialis, medially vastus medialis, laterally vastus lateralis, rectus femoris. Towards this is the apex of the patella, which gives attachment to ligamentum patellae. What is attached to the apex of the patella is ligamentum patellae. Now you trace the anterior and posterior division of the femoral nerve. See on the picture, the anterior division gives off branches to sartorius, and the posterior division gives off 4 muscular branches and 1 cutaneous branch. The cutaneous branch is nothing but the intermediate cutaneous nerve of thigh. So clear? You trace the picture from above downwards. There are 2 distinct colors, one dark green and one light green color, right? So that light green color is the anterior division, which is giving off medial cutaneous nerve of thigh. What type of muscle is pectineus? Like brachialis. Brachialis is what type of muscle? Brachialis, hybrid muscle, right? It has both nerve supply from radial nerve and musculocutaneous nerve. Likewise, pectineus also hybrid muscle. It is supplied. It is forming the floor of the femoral triangle. It is innervated by both femoral nerve and oblerator nerve. Both nerve from anterior compartment and medial compartment will supply pectineus. So it is hybrid muscle. Pectineus is a hybrid muscle. So common action is knee extension. All the quadriceps will extend the knee. Next is medial compartment of the thigh. Anterior compartment over. We saw already femoral triangle, femoral artery, femoral nerve, quadriceps femoris. Next is medial compartment. Medial compartment of the thigh, where the muscles are arranged as first muscle is gracilis, which is otherwise called virgin muscle, adductor longus, which is otherwise called as rider's muscle, adductor brevis, and adductor magnus. Largest muscle is adductor magnus. As what you want to remember is adductor magnus. I said femoral artery. Am I right? Which is giving off medial circumflex and lateral circumflex. This is medial circumflex. This is lateral circumflex. This femoral artery, before continuing as popliteal artery, it pierces the adductor magnus. You get, can you able to see this? There are some openings here, right? Can you able to see on here? There are some openings. Am I right? How many openings? 4 openings. That this opening is for popliteal. Up to this side, this is femoral. Beyond this opening, the same artery is called as popliteal. This is called adductor hiatus. Adductor hiatus. So you get the opening for perforators. This artery are called as perforator artery. Perforator artery. So how many perforators? 4 perforators are present on the medial compartment of thigh. Medial compartment of thigh. Medial compartment of the thigh. And the nerve supply to the medial compartment is through obturator nerve, which arises from the posterior division of lumbar plexus L2, L3 and L4. We already, what are all the structures piercing oblique popliteal ligament? Third one, the branch from obturator nerve is piercing oblique popliteal ligament, right? So from medial compartment, a nerve enters the popliteal fossa to pierce it. Am I right? So apart from muscular branches, what is genicular? Genu is, what is the word genu represents? Genu is bend. Any bend is called as, here the bend is, what is the bend? Knee joint. So it supplies genicular branches now to the knee joint. The artery of the compartment is again obturator artery. This artery is obturator artery. So remember the name of the muscle for the medial compartment: gracilis, adductor longus, adductor brevis, adductor magnus. What you should remember is how many openings are present on the adductor magnus. Adductor longus is forming the boundary for femoral triangle. Also, it forms the floor for femoral triangle. Next compartment is, what is this compartment? Posterior compartment of thigh, otherwise called as hamstring compartment. Otherwise called hamstring compartment. What are all hamstring? We'll go to the posterior compartment muscles first. Then I will tell you what are all the criteria for a muscle to be hamstring. There are some criteria to be hamstring. The muscles on the posterior compartment of the thigh are semitendinosus, semimembranosus, and biceps femoris. These are the muscles of posterior compartment of thigh. There are 3 muscles on the posterior compartment of the thigh, and you get a larger nerve on the posterior compartment. The nerve is sciatic nerve. Now I will tell you what is hamstring. The muscle should take origin from ischial tuberosity. It should take origin from ischial tuberosity. It should get inserted into either bones of the leg, tibia or fibula. It should be innervated by the tibial component of sciatic nerve, not the peroneal component. It should be innervated by tibial component. Now I'm including adductor magnus, one head of the adductor magnus on what is this? Hamstring. But we discussed adductor magnus is a muscle of medial compartment. But I am including this on hamstring. Why? It is because one head of the adductor magnus is taking origin from the lower part of the ischial tuberosity. So I am including it as hamstring. And there are two heads for biceps, long head and short head as of upper limb. Only the long head is hamstring, not the short head, because short head arises from femur, not from ischium. So when you include hamstring, you have to say semimembranosus, semitendinosus, long head of biceps, not the short head, and the adductor and the hamstring part of. There are two parts for adductor magnus. One is the hamstring part, other one is the adductor part. So totally how many muscles form hamstring? 4 muscles: semimembranosus, semitendinosus, long head of biceps femoris, and the hamstring part of adductor magnus. Which head is not included? Short head is not included, but it is a muscle of posterior compartment of thigh. Is it clear? All these are supplied by tibial part of sciatic nerve. You are clear with this, right? Now you see on the picture for the origin, you divide the ischial tuberosity. You know the ischial tuberosity where it is present, right? Ischial tuberosity. And this is ischial tuberosity, right? Lower down it is ischial tuberosity. So the muscles take origin from ischial tuberosity. Upper lateral part is for semimembranosus. Upper medial part is for semitendinosus. Lower lateral part is for adductor magnus. Semitendinosus is along with the long head of biceps femoris. This picture tells you the origin of the hamstring part of hamstring muscle. All these muscles are inserted into either bone. So semimembranosus and tendinosus will be inserted into tibia, upper end of tibia. Biceps is lateral, so it is inserted into fibula. Remember, membranosus, tendinosus, which is forming the superomedial boundary of the popliteal fossa. Am I right? Superomedial boundary of popliteal fossa structures are medial, so it is tibia. Superolateral is biceps femoris, which is lateral, so it is inserted into tibia. What is the nerve of the? So can you able to see the two heads? Biceps femoris. All are supplied by sciatic nerve. Next compartment is anterior compartment of the leg. After this, peroneal nerve divides into tibial nerve and superficial peroneal nerve and deep peroneal nerve. So this is a summary what we discussed. So up to this we finished. Tibial nerve supplying posterior compartment. Anterior compartment is supplied by deep peroneal nerve, and lateral compartment is supplied by superficial peroneal nerve. The muscles of the lateral compartment are 2 in number: peroneus longus and peroneus brevis. Can you able to see the anterior tibial artery on the center, which is continuing as dorsalis pedis artery, and the nerve is deep peroneal nerve, which is supplying all the muscles of anterior compartment of the leg. Injury can common peroneal nerve occurs on these 2 reasons: fracture of neck of fibula and pressure from the causes the splint. What we do, which causes The clinical features. So mainly these muscles are involved if the common peroneal nerve is involved. Common peroneal nerve means it is supplying both the anterior compartment and lateral compartment. So these are all anterior compartment muscle which are all paralyzed. This is the lateral compartment muscle. These are all anterior compartment of leg. This is the lateral compartment. This is anterior. This is the peroneal nerve. This is superficial peroneal nerve. Both are branches from common peroneal nerve, where the loss of eversion and dorsiflexion of this is the reason for foot drop. Sensory loss of sensation along the anterior and lateral side. I'll show the picture how the sensory loss. What is the nerve lying over the dorsum of the foot? Totally 7 on the. Totally how many? 7. Yesterday we discussed, right? Here you see for the dorsal interossei. How many in number dorsal interossei? 1, 2, 3, 4. Am I right? There are 4 interossei which are all bipinnate. All are bipinnate. Supplied by the posterior, sorry, the tibial nerve. Supplied by the tibial nerve. What is this compartment of the leg? Posterior compartment. So which muscle forms the bulk of the posterior compartment? Gastrocnemius. This muscle is gastrocnemius and soleus, which is otherwise called peripheral heart. It is otherwise called peripheral heart. Why it is called peripheral heart? It pumps the blood against gravity. So venous return. How much of venous return to the right atrium? So that is maintained by the both soleus muscle. Now on the superficial posterior compartment, what is the vein running above? Short saphenous vein, which drains into popliteal vein, and the cutaneous nerves are sud nerve, saphenous nerve, and lateral cutaneous nerve of calf. These are the cutaneous nerves that are present on the posterior compartment of the leg. Now, as we know, biceps has 2 heads. Here, the gastrocnemius also has 2 heads. The 2 heads unite to form a muscle mass, which is inserted over as a tendon. This tendon is called as Achilles tendon, otherwise called tendo-Achilles, which is attached to the calcaneum. Remember, all the muscles of the posterior compartment. Already we will finish the anterior muscle by the lateral compartment. 2 muscles is supplied by superficial peroneal nerve. Tibial nerve at level of popliteal fossa enter into the posterior compartment of the leg by passing through the lower border of popliteus muscle. So locking and unlocking of the knee is due to muscle on the posterior surface of the knee called as popliteus. So what is the name of the tendon? Once you remove, you get a muscle, small muscle fiber and a long tendon. Small belly, long tendon. Name of the muscle is plantar. Muscle with small belly, long tendon, going towards the plantar surface of the foot to give off an aponeurosis expansion corresponding to the palmar aponeurosis of the hand called as going towards the plantar aspect. So plantar aponeurosis, right? So far we completed gastrocnemius, soleus, which is the peripheral heart, and plantaris. Right? Next muscle is popliteus. Next muscle is remember this word, unlocking muscle. Unlocking muscle. popliteus. Unlocking muscle is popliteus. Next tendon is flexor hallucis longus and flexor digitorum longus, corresponding to the extensor hallucis longus and extensor digitorum longus and anterior plane. Right? But you see, these tendons are going towards the foot. Right? Plantar face. Extensor retina is on the dorsum, but this should go to the deep to the plantar region, right? It is present deep to the plantar aponeurosis on the plantar surface. That's all. Okay. Now next is tibialis posterior. The peculiar tibialis posterior, it is inserting into the all the tarsal bones except medial uniform. Except medial uniform. That is the peculiar feature of tibialis posterior. This is the peroneal retinaculum. Now we know all the muscles of the posterior compartment of the leg are supplied by what now? Sciatic nerve. This is the sciatic nerve. Here you get common peroneal nerve. Here you get the tibial nerve. So tibial nerve enters the plantar surface by dividing into medial plantar nerve and lateral plantar nerve. Medial plantar and lateral plantar. Medial plantar and lateral. Medial plantar and lateral plantar nerve. Now you see the summary of the arterial supply of the lower limb. External iliac continues as femoral artery. Femoral artery continues as popliteal artery. So this extent you should know. From the mid of the inguinal ligament till the opening on the adductor magnus. I said 5 openings. Larger opening is 1 for popliteal and 4 minor openings for the perforator. Alright. So up to that level, because it is a single lumen, we are dividing at each region as one artery. So up to that it is femoral artery. From the upper border of the popliteal fossa till the lower border of popliteus, it is called popliteal artery, which is dividing into anterior tibial and posterior tibial. Anterior tibial continues as dorsalis pedis artery, whereas the posterior tibial divides into medial and lateral plantar artery. As like tibial nerve, posterior tibial artery is dividing into medial and lateral plantar artery. Now, see this closely. Femoral artery, this is the mid of the inguinal ligament, and this is the popliteal artery. Now, I said there are two circumflex femoral artery. One is medial circumflex, other one is lateral circumflex. And profunda femoris artery, which is descending down, they gives off perforating branches. 4 in number. Perforators are 4 in number. And this opening on the adductor magnus is called as adductor hiatus. Adductor hiatus. Adductor hiatus. Popliteal artery gives off genicular branches. And they divide into anterior tibial and posterior tibial. This is medial, this is lateral. Upper middle genicular artery, middle genicular artery, lower medial genicular artery, upper lateral genicular artery, and lower lateral genicular artery. So genicular artery are how many in number? 5. Genu is bent. Here the bend is knee joint. That gives off 5 branches. Here 3 branches, here 2 branches. Genicular branches are 5 in number. Genicular anastomosis. What is anastomosis? What is anastomosis? Communication of one artery with each other is called as anastomosis. So the genicular branches anastomosis each other around the in front of the knee joint. What is dorsalis pedis artery? Anterior tibial artery continues as dorsalis pedis artery over the foot, over the dorsum of foot. During diagnosis, we palpate the vasculature of the foot only. It is because whether the dorsalis pedis is intact or not. Okay. So next, venous drainage. What is this arch? Dorsal arches, dorsal venous arch, which continues above medially as great saphenous vein, which continues laterally as short saphenous vein. Able to see great saphenous, short saphenous. We already know great saphenous vein drains into longer vein drains into. What is this opening called? Saphenous opening. Into which vein? Femoral vein that drains into femoral vein. This is the short saphenous vein that drains into. Where it drains? Short saphenous vein. Popliteal vein that drains into vein. Great saphenous vein drains into great saphenous vein into femoral vein. Great saphenous vein is nothing but the lateral end of dorsal venous arch. Right? Dorsal venous arch. Sorry, the medial end. Medial end of the venous arch. If it is going medially above, that is great GSV, great saphenous vein. If it is going laterally, short saphenous vein. This great saphenous vein drains into femoral vein. This drains into popliteal vein. This is on the popliteal fossa. This is on the femoral vein. Understand, right? It's very easy. What is this one? So you get perforator veins on the lower, connecting the superficial veins of the skin and the deep veins of muscle. You get some veins called as perforator veins. So independence of this vein leads to elasticity of the musculature of the vein that leads to a condition called as varicose vein. That condition is called as varicose vein. Varicose vein. Lymphatic veins. So you have a superficial inguinal group of lymph nodes and deep inguinal group of lymph nodes. There are two lymph nodes that are present on the lower limb. One is the superficial group, and one is the deep group. So you have a T-shaped structure, that is the superficial group of lymph node, which are present to the inguinal ligament. So all the lymph vessel from the lower limb is carried out by superficial lymph vessel as well as the deep lymph vessel. They ultimately drain into the lymph node. Lymph vessel will carry the lymph fluid that has been poured into the lymph node. That from lymph node it goes to the venous channel. Superficial lymph node is deep group of lymph node. Where is present? Not clockwise. Femoral, sheath, medial, intermediate, lateral. Here you get vein, here you get artery, here the lymph node is clockwise group of lymph node. Clockwise group of lymph node. What is this joint? Ball and socket joint, formed by the upper end of femur and the acetabulum, which is a fibrous synovial type of joint. This is a plain X-ray of AP view of hip joint. If you draw a line from the upper margin of the obturator foramen, the neck of the femur, this is called Nelaton's line. This line is called as Nelaton's line. This should be in continuity during a normal X-ray. If this convexity is not present, the fracture can be elicited. That line is called as Snellen's line. What is this joint? Knee joint. The joint is knee joint. Lower end of femur, upper end of tibia, patella. So this joint is knee joint. So there are 12 ligaments present on the knee joint. Each ligament has attachment. I am not going with this. Already we finished oblique popliteal ligament. Hope you remember, right? Along with popliteal fossa, which is the expansion given off by semimembranosus. This you have to read by semimembranosus muscle pierced by three structure. From where it comes, structure piercing. You should remember this. We already discussed. Have you heard of menisci? This is the upper surface of menisci. We have a medial menisci and lateral menisci. Both are sheath-shaped structures attached to the intercondylar area of the tibia as well as to the margins of the tibia on the upper end. That we call it as menisci. Because menisci here are very common. It's a plain X-ray of knee joint, AP view knee, AP view of knee. This is the tip. You get it. The superimposition structure is the patella, medial condyle, medial epicondyle, intercondylar area, head of fibula, neck of fibula, medial condyle, lateral condyle. This is the joint space. It is simple joint or complex joint? Complex joint. Ankle joint. At least articulation of the bones you should remember. Main ligaments I am telling. Articulation of the bones you should be very clear. Okay. Ankle joint is formed by above by tibia, below by talus. It is formed by calcaneal feature. Tibia is above, talus is below. So calcaneum is not taking place. Am I right? So remember, ankle joint is formed by tibia, lower end of inferior surface of lower end of tibia articulate the talus. A part of fibula is also taking part. Right? So ligaments of the joint are deltoid ligament, talofibular ligament, and these ligaments are important. Deltoid ligament, posterior talofibular, and calcaneofibular ligament. Because ankle sprains are common, by the time you get tear of deltoid ligament is a common during ankle injuries. Okay, so the ankle ligament predominantly responsible for the support and opposition. And these are the three ligaments. You will be concentrating on the ligament attachments. See on the picture, can you able to see this? Anterior, inferior, tibiofibular. As the name indicates, it extends from tibia to fibula. Talofibular, talus to fibula. Now you see on the deltoid. How many components are there for deltoid? A single ligament having three components. So clear. So that is the reason why you should know deltoid. During ankle sprain, not all the part of deltoid is involved. Either a part of the deltoid will be involved. Plain X-ray of ankle joint showing the foot. I think X-rays you can go through, right? A 21-year-old man was involved in a motorcycle accident resulting in destruction of the groove in the lower surface of the cuboid bone, which this muscle tendon is likely to be involved. Cuboid is related to peroneus longus, and this I did tell you. A thoracic surgeon is going to harvest a portion of the great saphenous vein for coronary bypass surgery. He has observed this vein runs. What is it? Great saphenous vein. Is going to harvest on the thoracic cavity. Superficial to the fasciolata of the thigh. It is running on the lateral side, right? It is on the fasciolata. Fracture of neck of femur results in avascular necrosis of femoral head, probably resulting from lack of blood supply from which of the following arteries? Probably from which of the following arteries? These two are seen in the gluteal region. This is seen on the medial compartment. Lateral should go towards the lateral side of the thigh. What is present medially is towards the head of the femur. So this answer is medial. A 34-year-old woman sustained a deep cut on the dorsum of the foot just distal to the ankle joint while a kitchen knife. A physician in the emergency department has laid it at the dorsalis proximal to the injured area. Which of the following condition most likely results as of the injury? Ischemia. Reduction of blood flow in medial tarsal artery. An elderly woman fell at home and fractured the greater trochanter of her femur. Which of the following muscles would have continued to function normally? The fracture is on greater trochanter. Gluteus maximus is inserted on iliotibial tract. All other muscles are inserted on greater trochanter. Gluteus maximus is inserted on iliotibial tract along with tensor fascia lata. Already tensor fascia lata. So that completes lower. The gluteus maximus. It is inserted on iliotibial tract. It is not on the greater trochanter. Now case questions like, right? Case questions.